Hi, Dwayne. Welcome. Stefan, Annie, Hattie, Farah. Hey, guys, welcome. The topic, pre and perinatal nursing, maternity, OB. That's what we're covering tonight. So come on in. Come into the room, guys. Hattie says, receive my book. It's amazing. Oh, Hattie, I'm so happy you're enjoying it. Hattie, listen to me, Hattie. Please listen to me. Everything you see highlighted in that book, you better know it. You hear me? You better know it. And when you go take that exam, if there's anything you remember seeing that's not in that book, please reach out to me. Email info@nexusnursinginstitute.com. Heather says, OMG, this was the topic the first week of my nursing program. I'm so happy I'm able to help. I see all of your comments. I need to get this book. Is it applicable for the PN one is coming out in about 5 weeks. It's coming out in about 5 weeks. Superstar, hi Professor, I received your book. It's amazing. I'm learning so much from it. Good, good. Everything you see in there, even if it's not highlighted, if I'm mentioning it, it's important. I mean, what I have highlighted is the most important thing, but if it's in there, that means it's important. So if there's anything in there that you're not too familiar with, take the time, go back into your textbook, read about it, make sure you understand it, because that one thing you say to yourself, oh, well, I don't understand it that much, but I'll be okay. You might get a case study on it. You don't want to miss out on easy questions just because you did not understand the basics. Thank you, guys. Thank you so much. For those who don't know, I'm pointing at, see these two books? These are the same book, by the way. So it's Nexus Nursing NCLEX cheat sheets. And basically, it's a collection of the topics that my students all over the country, they've taken NCLEX, they pass, and it doesn't matter what state they're testing in. They're seeing there's certain topics. It doesn't matter what state you're testing in. They are seeing it over and over and over and over again. So I really the topics and the drugs and the nursing interventions and those diagnostic tests that the students keep seeing over and over and over again, I just kind of put it together for you. I made study guides out of them, and I put it together just to help you guys kind of focus. So if you don't know anything else, if you know nothing else before you go take your boards, at the minimum, you better know everything that I have in this book right here. Do I have a copy with me? I'm being late. I don't want to get up. Hold on. We're going to get started once we have 100 people in the room. So far, we have 33 people. If you're not in the room yet, come on in. The code to get in is 819-3452. 819-3452. If you haven't gotten your copy yet, you can get your copy on my website. I'm going to kind of open it up so I can show you kind of what it looks like. Oh, Junelle, I'm not on pre-order anymore. So as you guys know, my book sold out like 3 times already. So I was on pre-order. I got a shipment. So the order is open. You don't have to pre-order, pay now, and just be guaranteed to get your book when it comes in. It is in. So if you order now, you will get your book. Now, guys, I sell out very quickly. So if you have not gotten your book, get it before it sells out. So I'm going to turn the camera. We're at 42, guys. We need to get 100 people in the room to get started. So I'm going to turn the camera around real quick so I can kind of just give you a sneak peek of what it looks like. Okay, let me turn this camera around. Oh, there we go. Don't mind the background. All right. So this is the book, okay? And I'm not even going to look. I'm just going to open up a random page. All right. So what are we looking at? I have no idea. What's the subject? Oh, Meniere's disease. Okay. So Meniere's disease, and for Meniere's disease, so 1, 2, 3, 4, 5, 6, so 8. 8 topics on Meniere's disease. Students all over the country, doesn't matter if they're in Florida, Kentucky, New York, Puerto Rico, they're seeing questions on the things that I have highlighted that I got a TQ next to. So for Meniere's disease, if you don't know anything else, you better know, let me go to the first part. So you better know which part of the ear that's affected, which is inner ear. You better know what causes those episodes. You better know what it's characterized by. You better know those signs and symptoms. And you see, let me tell you something. When I highlight just the topic and not individually, you want to know what that means? They're seeing those as select all that applies. Remember, I taught you when you do select all that apply, treat them as true or false. That's what it means when you see I do that. Okay? What else? The dietary management, select all that applies, and pharmacologic therapy such as the diuretics, antihistamines, antiemetics. There's more, but the ones I have highlighted, those are the ones that the students are seeing the most. Now, something you guys need to understand, when students go, and these are students that I've tutored, they go take their boards, they pass, they come back and they tell me what they saw. I don't care what they chose as their answer because I don't know if they got it right. It's not like you went and took your test and you got 100% of the questions correct. No, you just met the minimum to get your license. So I don't know what you chose, right or wrong. So I don't care what students chose as their answer. I don't even ask them what their answer was, what the options were. I don't care. I care about what you're being asked, the content that you need to know like the back of your hand. Okay? How can I purchase my website? nexusnursinginstitute.com. Soon you'll also be able to purchase on Amazon. By I think next week it'll be up on Amazon and TikTok Shop. If you have TikTok, it should be up on TikTok Shop as well. But for now, my website, nexusnursinginstitute.com. We are currently at 44. The code to get in is 819-3452. 819-3452. Matter of fact, I'm going to turn the camera around so you guys can see the screen. 819-3452. That's the code to get in. We got 45 people in the room. Claude says, good luck to the new nurses. Welcome to the profession. It's a great ride. I absolutely love it. Thank you, Claudette. And Claudette, I'm so happy you're joining us. Superstar Family says, when is the RN test bank coming out? Oh my gosh. It is coming out once I get the book out for PNVN and for the nurse practitioner students. I got to do something for everyone because you know what? You guys be acting jealous. Y'all be doing the most with me, right? So the first book that came out was for RN. The next one that's coming out in about 5 weeks is the one for PNVN. After that, I need to release the one for the nurse practitioners. Okay? After that, my test bank for all three will be out. So just have some patience with me. Can I purchase it for fundamentals? You can, Klana, but here's what I'm going to tell you. Let me turn around. Klana, I don't believe in anyone spending money unless they absolutely have to. If you're in fundamentals, there are some, I can't even say how many in this book because I didn't count. I can't remember. There are some fundamentals content that's on NCLEX, but not too many. That's number one. Most of the questions are based on the fundamentals, but not fundamentals direct, right? That's number one. Number two, there's a better resource for you, and it's much cheaper, okay? Because my book is not cheap. It's $95. Now, it's worth much more than $95 because I'm giving you the blueprint, but it's not cheap. But if you're in fundamentals, there's something more detailed for you. Number one, if you go to my YouTube channel and you go to my fundamentals playlist, I have hundreds of videos. Whatever your next test is coming up on, I have at least five to six free videos on that subject matter. It's not going to cost you a penny. So I encourage you to do that. That's number one. And number two, I have audio lessons. Now, the audio lessons, those are for sale. But listen, so many times I find students think that they need me and they really don't. It's like I'm a comfort blanket for you, but you really don't need me. So my audio lessons are really for the students who are completely lost. They have no idea what's going on. They're in fundamentals, or, you know, I'm saying fundamentals because that's what you're in, but whatever part of the program they're in, and they're about to fail out. and they need a Hail Mary. They literally need me to hold their hand and walk them through the program. That's what the audio lessons are for. If you're doing pretty okay, you're doing good, you just need a little help here or there, just watch my YouTube videos. They're free, and I don't believe in fluff, so I'm giving you the meat and potatoes. The audio lessons are for the people who are about to flunk out. They have no idea what's going on, and they just kind of need me to hold their hand. So I would not even encourage you to buy the audio lessons unless you really need it. If you don't, listen to my podcast, watch my videos. Both of them are free. You'll be good to go. I don't want you spending any money unless you absolutely have to, okay? Hello, what about MedSurge for PN? If you're talking about the audio lessons, I have audio lessons for the whole program. Fundamentals, MedSurge, OB, Peds, Psych, you name it. But again, it's only for those students who are really, really struggling. Like they need to get an A on their next test or they're going to fail. That kind of student. If that's not you, you don't have to spend any money. I'm trying to help you out. It's free. Watch my YouTube videos. Listen to my podcast on that subject matter. Hi, can anyone type the code for Kahoot? The code is 819-3452. 819-3452. Matter of fact, let me turn the camera around again. 819-3452. Mosey that says, thanks for all that you do. I passed my NCLEX. Congratulations. I'm so happy for you. Ted says, hey, what about health assessment class? I need help. Health assessment, those videos you will find in the fundies, in my fundies playlist. Where are your audio lessons? On my website, the same place you can get my book, nexusnursinginstitute.com. Nail Time says, I'm on your channel. Don't see too much MedSurge. Nope, you are looking the wrong very quickly, guys. I'm going to go to YouTube to show you these playlists very quickly, and then I'm going to come back to this Kahoot. Because I don't know where you're looking, but let's get this straightened out. All right, let me see. I'm trying to go into YouTube like a regular viewer channel. No. I'm not sure how to do that. Let me just go to my playlist. All right, so guys, look at my playlist. MedSurge GI, I've got $34 videos, right? Look at this. MedSurge GU, 40 videos. Kahoot, 146 videos. Fundamentals of Nursing, 112 videos. MedSurge Cardio, 58 videos. Peds, 111 videos. MedSurge Integumentary, 26 videos. Guys, just go to my playlist for whatever you're doing in the nursing program. I've got dozens and dozens and dozens of videos. And they're free. Doesn't cost you a penny. Do you have DVT, PVD, PAD? Absolutely. You want to know where you can find them? In my cardiac videos. You didn't see mental health? Let me show you where mental health is. You guys are playing. Scroll down. Bipolar, oncology, OB, respiratory, case studies, A&P. Let me find mental health. Sensory, hematology, musculoskeletal, psych, neurology, endocrine, peds, integumentary, cardio, Kahoot. Where's my mental health? Maybe it's on the next page. Hold on a second, guys. You guys know I love Jesus. All right. Let me look. Case study. A&P. Sensory, respiratory, OB, hematology, psych. Look at this. I have 90 videos. Psych. It's right here, guys. Who said they don't see psych? Let me move my face. Do you see this? I have 90 videos in the psych playlist alone. Yes, Kira. Kira Johnson says she has everything in there. Go on my page. It's all in there, guys. And I even broke it down into playlists. So no matter where you are in the nursing program, I've got dozens of videos to help you for free. Okay? All right. Guys, we only got 60 people in the Kahoot. We can't get started till we have 100. Come on, let's go. Ted says she has everything. They're just not looking. I'm telling you, it's all there. Alan said Professor D's putting in the work. Yup. You see that too? How can I order the book? On my website, nexusnursinginstitute.com. nexusnursinginstitute.com. I sold out and I only had pre-order available. The new shipment came in yesterday. So that means if you go on my website and you purchase that book, you are getting it immediately. Get your book before it sells out. What's the topic on Kahoot on pre and perinatal nursing? Professor, do you have an option to get the book in color? That is the only option. I discontinued the black and white line. So once I sold out my last 2 shipments, I stopped the black and white books. All of the books are color. They're all color. Do you have soft copies for those out of the USA? What do you mean when you say soft? The book is not hardcover. I'm going to show you again. Maybe you came in late, but this is the book. Hold on. This is the book. And so it's not hardcover. And so while supplies last with this, and actually this is the older version. I think this was the first one before it sold out. The ones that you guys get now, let me get a copy of that to show you the difference. It's sealed, so I can't open it, but there are just a couple things that are different. I've got my signature on here. I've got a prayer on the inside, and with each one, I'm being lazy. I don't want to get up. But I have a little gift that I send you guys with the book. So the content on the inside is different. It's just the outside that's a little bit different than the inside. What is the target audience for the book? It's for students who are in their last semester of the nursing program and they have to take an exit. You know, the exit that covers everything you learned throughout the program. It's for them and for the students who have graduated already and they're taking NCLEX. And the reason I say that is because the exit follows NCLEX. They follow that pattern. So whether you're taking exit or you're studying for NCLEX, this is to help you. That's the target. Thank you, Amanda. Guys, we're at 64. The code to get in is 819-3452. 819-3452. Thank you, Amanda. The website, nexusnursinginstitute.com. Cordelia Alexander says that scripture is one of my favorites. Is one of my favorites as well. Same. B. Robinson says PN. Yes, the book for PN is coming out in about 5 weeks. The website for the book, Bob, is nexusnursinginstitute.com. Nail to me says, it works with ATI because my school uses ATI, so I'll need a book for exit. Yes, it works for ATI and HESI. It absolutely does. It absolutely does. If you got my book, you studied my book, and you go take your boards, if there's anything you remember seeing on your boards that is not in my book, please reach out to me. Send an email to info@nexusnursinginstitute.com. It will get to me, okay? Let me know what you saw on the exam that was not in my book. I really want to know. info@nexusnursinginstitute.com. If you need to get the book, you'll go to nexusnursinginstitute.com. Let's get our numbers up, guys. There's 64 people in the room. We get started when we get to 100. So while we're waiting to get to 100, any questions? You guys have any questions for me? What's going on with you guys? Anyone at Chamberlain? I graduated from Chamberlain. What are you doing at Chamberlain? Are you doing BSN, MSN, Ismatic? What are you doing there? Amanda says, you are amazing, Professor D. I love the way you teach. Thank you. Thank you so much. I bought the cheat sheet. I'm currently in nursing school. Will it help? Yes, it... Keisha, listen to me. Listen to me. If you see it in there, whichever semester you are in, if you're covering those topics, know it. I don't do fluff. If I'm talking about it, I took the time to write it down. It's important for you to know. Yes. Yes. NCLEX RN cheat sheets. That's it. I'm in Chamberlain for BSN, taking complex adult health. Okay. I love their program. I'm a graduate from there. I did my BSN and I loved it so much. I did my MSN. And let me tell you something. When I did my MSN, I took my boards 3 weeks before I graduated the class. I was still in the class when I took my boards. I was the very first person to take boards for to be a nurse practitioner. And everyone in my cohort was waiting for me to take that test. By Bolu Life, by going to my website, nexusnursinginstitute.com. Kola says, do you think reading all the textbooks will help? Let me say this to you. I'm old school. And the reason I'm old school is because it works. I know we have a million things available to us as students, so we don't have to read the book. But at the end of the day, I'm telling you, everything else should be extra, but you got to read your book. And here's where you pay special attention to, because I'm going to tell you where your questions come from. Your test questions are coming from the parts in your book that repeat itself. So when you're reading content, and let's say you read something and 2 pages later, they say the same thing except in a different way, and then 3 pages later, they say the same thing, and that's going to be on your test. Information that repeats itself, that's going to be on your test. Things that are bolded, things that are highlighted, things that are underlined, things that are italicized, things that are in boxes, things that are in figures, things that are in illustrations or tables. Nursing alerts. Those are where your test questions come from. Think about it. If the author of the textbook gives you a piece of information in the text, and then that same piece of information they put in the text, they decided to give you an illustration on it, or put it in a table, or a box, or a diagram, or a nursing alert. Why do you think they're repeating that same piece of information in different ways? Because it's so important. They want to make sure that you get that concept because it's going to be on your test. Duh. So yes, read your book. That is the first thing you need to do. Read your book. Go to class. Listen to lecture. Look at the PowerPoints. See, I read that in my book, and now I'm hearing it in a lecture. That's the second time you're touching that information. Then you go home, and I don't care what you use to practice questions, whether it's Mosby, Saunders, Lippincott, Davis, it doesn't matter. But you practice questions, and you're seeing those concepts again. That is your third time touching that information. And then you go to YouTube. And you go find my playlist on whatever exam you got coming up, and you watch my videos, and you listen to me talk about the rationales to the questions I go over. That is your fourth time touching these questions. And then you're driving, you go to the gym, you're working out, and you're listening to my podcast, you're listening to my lectures talking about this information. That is your fifth time touching this information. You don't think by the time you take your test, you're going to do pretty well? Come on. It's really about repetition, but repetition from good sources. Okay? All right, you guys are killing me. How do we only have 66 people in the room? I might get started once we hit 75 because it's taking forever for us to get to 100. Lily says, you helped me pass my NCLEX. I'm now a nurse. Love your videos and still watch. Oh, I'm so happy I was able to help you. Robin says, yes, your videos helped me pass pharmacology. Tell them, Robin. Please let them know. Cordelia, Professor D, do you do one-on-one tutoring for NCLEX RN? Yes, I do, but my calendar is currently closed. I'm just so busy, I don't have the time to tutor. Once my books are out for everyone, RN, PN, NP, I'm going to start tutoring again because that's where my heart is. My heart is being with you guys. That one-on-one instruction and the joy I get when it finally clicks and you get it and you can explain that information to me. That's how you know when you know information, when you can explain it to someone else. Becoming Nurse Kim, she says, I got the book and love it. I'm so happy you love it. All right, we're at 72. Once we get to 75, we're going to get started. Maria Ocampo says, I got your book. It's coming October 20th. That's what I'm talking about. You guys, get your book before it sells out. Okay, we're at 75. We're going to get started. We're going to get started. We're at 75. Well, let me make sure I'm recording. You guys remember that one time I did a whole Kahoot and at the end realized that I wasn't recording? I almost died. Is the book still available to be purchased? Yes. You can purchase it by going to my website, nexusnursinginstitute.com. nexusnursinginstitute.com. Get it before it sells out. We're covering OB. All right, let's get started. Prenatal nursing. First question. Okay, so select all that applies, guys. All right, what are the presumptive signs of pregnancy? Select all that applies. What are the presumptive signs of pregnancy? Here are your options: nausea, vomiting, amenorrhea, breast fullness, urinary frequency, fatigue. Select all that apply. What are the presumptive signs of pregnancy? Nausea, vomiting, amenorrhea, breast fullness, urinary frequency, fatigue. Can you zoom out? The answers are cut off. Let me see if I can zoom. No, it's not. Let me push this back. Is this better? Is this better for you guys? Okay. All of them. All of them. All of these are presumptive signs of pregnancy. What are presumptive signs of pregnancy? Those are signs that, yeah, you might be pregnant. We see this a lot in pregnancy, but doesn't necessarily mean you're pregnant, because guess what? We see this in other conditions as well, right? So nausea and vomiting, yes, we see that a lot in pregnancy, but we see that in a lot of other conditions. Same thing as amenorrhea, not having your menstrual cycle. Breast fullness, or sometimes NCLEX will, what will they, what's the other phrase they'll use? Tingling or sensitivity. Urinary frequency, fatigue. Let me give you some other presumptive signs of nursing that NCLEX asks about that you need to know. Guys, if you're studying for your boards, please make sure you take notes. If you're not taking notes now, because this is going to be on YouTube, go back and watch it. The code to get in the Kahoot is 819-3452. 819-3452. Matter of fact, can everyone on the live, can you please type the code to get in for latecomers? 819-3452. Type that on the live for me, please. What was I going to say? Oh, yes. So on NCLEX, the other presumptive signs that they do ask about that you need to know, make sure you guys write this down. Quickening. That feeling of the fetal movement that they may feel quickening. Linea nigra, that's the skin changes. And largening of the areola or darker pigmentation of the areola. All of those are presumptive signs of pregnancy plus the screen, okay? All right, next one. At how many weeks should the fundus be located at the xiphoid process? Type in your answer. If you're on the pin, type, if you're on the pin. If you're on the Zoom, type in your answer. If the fundus is at the xiphoid process, how many weeks gestation are we looking at? Guys, type your answer on the live. What do you think? If the fundus is located at the xiphoid process, how many weeks? Type in the number. How many weeks gestation should she be in? Seven, 36, 8, 30, 13. You guys were all over the place. 36. Let me see what else you guys said. Hold on. 3:15. Oh, you guys were just guessing. You guys were just guessing. Okay. So the correct answer is 36. You need to know that. Let me ask you guys another question before we move on. Let's say the woman is at 16 weeks gestation. Where would you expect that fundus to be? Do you guys know? You got to know it for boards. At 16 weeks, do you know where? Halfway between the symphysis pubis and the umbilicus. Halfway between the symphysis pubis and the umbilicus. Okay? Now, how many weeks gestation would it be if the fundus is at the umbilicus? How many weeks? If the fundus is at the umbilicus, how many weeks gestation? 20 to 22. Those three things I just asked you about, you need to know it for NCLEX. Don't say I didn't warn you. Select all that applies. Which discomforts of pregnancy are seen more in the first and second trimesters of pregnancy? Select all that apply. Here are your options. Nausea and vomiting, heartburn, breast tenderness, ankle edema, urgency and frequency, varicose veins. So out of all of these clinical signs and symptoms, which ones are seen more in the first and second trimesters of pregnancy? More in the first and second than third. Which ones, guys? If you have not joined us in the Kahoot, you can still participate on the live. Just type in your answer on the live, what you think. Okay, let's talk about this. The discomforts of pregnancy we see more in the first and second is going to be nausea and vomiting, breast tenderness, and urinary urgency and frequency. You see those other options, heartburn, ankle edema, varicose veins. We see those more in the second and third. We see them more later on during the pregnancy, okay? Now, for nausea and vomiting, what are you going to teach your patient? You're going to teach your patient about having small, frequent meals, staying away from fried foods, staying away from fatty foods, not drinking and eating at the same time. They should drink between meals, but not with meals. All of those make a big difference. And also crackers, that helps, right? Sucking on sugarless candy, that can help with the nausea and vomiting. What about breast tenderness? What are you going to teach the patient? You're going to teach the patient to wear a supportive bra. You're going to teach the patient when they shower not to put soap on the nipples or the areola because it causes dryness and it can cause irritation, right? What about urinary urgency and frequency? What are you going to teach them? You're going to teach them about staying away from natural diuretics, things that have caffeine in them, like, of course, coffee, tea, stay away from soda. You're going to teach them to, when they go to sleep, instead of sleeping on their back, to sleep on their side so there's not too much pressure on the bladder, right? You're going to teach the woman about Kegel exercises. Professor D, when will this be uploaded on YouTube? I have finals next week and want to use this to help study. It's going to, as soon as this is over, it should be uploaded within 20 minutes of the Kahoot being over. It won't be long. Okay, type in your answer. Chorionic villus testing is performed 10 to blank weeks of gestation. What number is blank? Chorionic villus testing, when is it performed? It's performed between 10 and how many weeks of gestation? Now, while you're thinking of your answer, I'll tell you what it is if you don't know. Chorionic villus testing, it tests for like genetic abnormalities. So actually what they'll do, they'll aspirate a small amount of the tissue to test it for genetic, I don't want to say the word deficiencies, but abnormalities, okay? What's your job as a nurse? You better make sure that the consent is signed and the consent was informed, right? 10 to what? 13. That's the answer. 10 to 13 weeks gestation. That's when they do it. Your job as a nurse, you better make sure that consent was signed and it was informed. So if they signed the consent, but they signed the consent under duress, they signed the consent after any mind-altering drugs were given, pain meds, anything, is not informed. And guess what? Guess who explains the procedure? Guess who explains the benefits? Guess who explains the risk? Not you. You're just there to witness. It's the healthcare provider, okay? All right. Type in your answer. Amniocentesis is best performed between 15 and how many weeks of pregnancy? Amniocentesis. 15 and how many weeks of pregnancy? While you're thinking of your answer, and I'll tell you what amniocentesis is. That is where they, with the needle, they'll withdraw fluid from the amniotic sac, and it'll help also check for like genetic abnormalities. Okay, so it's not tissue that's being tested; it's going to be fluid, and they'll test the fetal antigens as well. And also, they use the amniocentesis to check for fetal lung maturity, to see if that fetus will survive outside of the womb. 18, 22, 28, 20. What's the correct answer? 20, guys. You need to know that. Between 15 to 20 weeks of gestation, no earlier than 15. Okay, 15 to 20 weeks. Why that time frame? Because by then there will be an adequate amount of amniotic fluid. Okay? Select all that applies. What are the risks of amniocentesis? So I told you what it is. I told you what they test for. What are the risks? Here are the options. Select all that apply. Infection, premature rupture of membranes, a miscarriage, fetal injury, Rh isoimmunization, hemorrhage. What are the risks? The woman's about to get an amniocentesis, and the healthcare provider is explaining the risks. What are those risks? Very good, future comedy. Judith, very good. There's more. All of them. And you need to know this, guys. The risk of amniocentesis, infection, and that makes sense because, guys, and this is a rule of thumb, not only from maternity, across the board, anything that is invasive, anything that's being introduced to the body, there's going to be a risk of infection, right? And I just told you what an amniocentesis is. Literally, they're taking a needle, right? And they're using that needle to withdraw amniotic fluid. So, of course, there's risk of infection. There's risk of the water breaking, premature rupture of membranes. There's risk of the woman miscarrying. There's risk of that fetus being injured. Rh isolated immunization, absolutely. And let me tell you, that is why. Whenever an amniocentesis is performed, if that mom is Rh negative, she's getting RhoGAM. Absolutely. And of course, hemorrhage. But there are two other risks that you absolutely must know for testing purposes. The first one is placental abruption. That is a risk that you need to know. There is a risk that the placenta will detach from the uterine wall after that 20 weeks, right? That is a medical emergency. And the second risk, guys, is, oh my gosh, I can't remember the name of it. I'll tell you what the pathology is, but I can't remember the term for it. But another big risk is when the fetus's fetal antigen gets mixed into the mom's bloodstream. And that is a medical emergency because that can cause cardiac pulmonic collapse of the mom because her body will literally react to it. Okay? It's called something embolism. I can't remember. Amniotic? I think amniotic embolism. Am I right, guys? Amniotic embolism. I think that's what it's called. I can't remember. But what happens is, like I said, when the fluid and the fetal antigen goes into the mom's bloodstream, and there's a chance of that happening, the mom's body will have a severe reaction to it. Okay? So that's very important. Make sure you guys know that. True or false? A reactive stress test is good. Is this true or is this false? So mom's getting a non-stress test, and the result was reactive. Is that a good thing or a bad thing? A reactive non-stress test is good. Is that true or is that false? Something you got to know about the stress test, it checks, the fetal, heart rate, the fetal well-being, oxygenation. It gives a lot of great information. If the result is reactive, is it a good thing? Yes, it is. Yes, it is. No, Retina, it's true. It absolutely is true. We want a reactive. Reactive is normal. Sometimes it might not be called reactive. It might be called negative. Same thing. It's good. Okay, it's a good thing. If it's reactive, if it's negative, that means it's normal. What does it mean to us if it's reactive, if it's negative, if it's normal? That means we're seeing 2 or more fetal accelerations of at least 15 beats per minute during that contraction lasting at least 15 seconds of acceleration. Okay? Okay. True or false? The non-stress test is an invasive procedure. Is this true or is this false? The non-stress test is invasive. Is that true or is that false? Oh, you guys are doing awesome on the live. Everyone's getting this right. False. It's not invasive. Type in your answer. A pregnancy that ends before 20 weeks gestation, whether spontaneous or elective, is known as what? Now, I'll give you a hint. It starts with an A. What is the word we're looking for? A pregnancy that ends before 20 weeks gestation, whether it was spontaneous or elective, this is known as what? Nice try, Jayla. I'll give you an A for effort. I like that. You're thinking. Come on, guys. No one knows the answer? I say it starts with an A. How you gonna write premature? Abortion, abrupt, true. Abortion. A pregnancy that ends before 20 weeks gestation, whether it was spontaneous, it was not expected to happen, or it was an elective procedure. Either way, if that pregnancy ends before 20 weeks gestation, this is known as abortion. Okay? All right, select all that applies. What are the risk factors for abortion? Now, remember, guys, abortion can be spontaneous or elective as long as it happens before 20 weeks that pregnancy ends. What are the risk factors for this to happen? Here are your options. History of miscarriage, having Cushing's syndrome, having lupus, smoking, drinking alcohol, having a high caffeine intake. Those are your options. Select all that applies. You guys are doing great on the live. Very good. The code to get in is 819-3452. 819-3452, but we're almost done. We only have 2 more slides to go. All of them, guys. All of these are risk factors for that pregnancy ending before 20 weeks gestation. Some more other risk factors that you absolutely need to be aware of. Having a history of an elective abortion, that places you at risk for abortion. Having uterine abnormalities like fibroids or scar tissue, that places you at risk. Having a high fever, a really bad infection, such as sepsis. Trauma. Imagine you're pregnant and you get in a really bad motor vehicle accident, right? Trauma. PCOS, polycystic ovarian syndrome. All of those are risk factors. Low progesterone. Okay? True or false? A threatened abortion is when the pregnant patient has spotting and cramping with cervical changes. Is this true or is this false? By the way, you guys need to know the difference between a threatened abortion versus a complete abortion versus an incomplete abortion. You guys need to know the difference. But for this particular question, a threatened abortion is when the pregnant patient has spotting and cramping with cervical changes. Is this true or is this false? Thank you, Nancy. Oh my gosh. 45 of you guys said true? There is one word in this sentence that made it false. And exactly what I did to you, that's what NCLEX does to you. And that's why I preach to you guys all the time. If your answer is not 100% correct, it is false. I don't care how beautiful that answer looks to you. If one thing in that answer is incorrect, the whole thing is wrong. Throw it out. What's wrong with this? Let me read it to you. It says an abortion is when the pregnant patient has spotting and cramping with cervical changes. A threatened abortion is when the pregnant patient has spotting and cramping without cervical changes. That cervix has not thinned. That cervix has not dilated. That one word with, that's what made this incorrect. You guys better stop playing. You better know the difference. Now let's talk about the difference between complete and incomplete abortion. So an incomplete abortion is when a portion of the fetal product has been released, but some of it has been retained. Okay? Complete abortion is when all of it has been released. All of the fetal product has been lost. None of it has been retained. By the way, when it comes to incomplete abortion, which again, remember, some of the fetal product remains in the body, usually it's going to be the placenta. Not always, but usually it's the placenta. Something else you need to know for testing. Risk for postpartum hemorrhage if any piece of that placenta stays within the woman. Okay? Professor D, I just ordered my book now. Can't wait to start reading it. Okay, Chi Chi. All right, true or false? The patient with preeclampsia is given magnesium sulfate to lower the blood pressure. Is this true or is this false? The patient with preeclampsia is given magnesium sulfate to lower the blood pressure. Guys, turn on your notification for me so when I come live, you guys will know. Turn on your notification for Nexus Nursing. You'll be notified every time I do a live with you guys. You guys are about to give me a heart attack. You got to be kidding me. 26 of you said... I'm turning this camera around because you need to look at me in my eyeball. Don't you ever in your life do that. Let me tell you, there are certain things NCLEX has been asking about since I started teaching this stuff in 2006. I don't know about before then, but since 2006, NCLEX has been asking the same question in a million different ways, but they've been asking the same question. Excuse me? Let's get this clear right now. Let me tell you guys something. There are way too many drugs on the market with way less side effects and adverse effects to bring down that blood pressure for us to give that patient magnesium sulfate. You must be crazy. You must be Looney Tunes. Let me tell you this. We give magnesium sulfate to keep that patient that's in preeclampsia from going into eclampsia. That's why we're giving that magnesium sulfate, because we don't want them going into seizures. Magnesium sulfate has so many adverse reactions. We're not going to give that unless we absolutely have to. We don't want that patient to have seizures. Now, one of the side effects of magnesium sulfate, because remember, what does magnesium sulfate does? It relaxes smooth muscle. That's how we prevent the patient from having seizures, right? So one of the side effects of magnesium sulfate is lowering the blood pressure. Okay, great. Because the patient with preeclampsia, the blood pressure is high. Great. But that is never an indication for giving magnesium sulfate. If I could wrap my hand around your neck right now and just shake you like this so you never forget, I'll do it. Because I promise you, this is one of the classic questions NCLEX loves to ask about. Do not be fooled. We give magnesium sulfate to prevent seizures, never to lower blood pressure. Does it lower blood pressure? Yes. Are we happy about it? Yes, but we'll never give it to lower blood pressure. Let me ask you this. If we do have to give magnesium sulfate, what are we going to make sure that we have right there available to us? What drug do we have to have right there available to us if we're going to give magnesium sulfate? Come on, quickly. Quickly. Calcium gluconate. Thank you. Thank you, Amanda. Calcium gluconate. That's the antidote. You need to know this. All right. Let me stop yelling at you. But seriously, guys, make sure you know that, okay? Okay, excellent. Okay. One more slide. One more slide. You guys are going to give me a heart attack. Select all that applies. What are the signs and symptoms of magnesium toxicity? Now, guys, I already explained to you what it does. What are the signs and symptoms of magnesium toxicity? This drug's working a little bit too well. What are those signs and symptoms? Here are your options. Select all that applies. Flushing, sweating, hypotension, depressed deep tendon reflexes, decreased urine output, CNS depression. If you haven't done so already, turn on your notifications for me so when I'm come on live, you'll be notified. All of them. All of these are signs and symptoms of toxicity that you need to be watching out for. And if you see these signs and symptoms, you're going to stop. Oh, let me turn this back on. You're going to, give me a second, guys. You're going to stop that infusion. Also, magnesium sulfate has to be given on a pump. It has to be given on a pump, okay? Shelly says, but it's the blood pressure. It's the blood pressure that causes the seizure, I thought. Shelly, I don't understand. But okay, what are you asking? Yes, that blood pressure being so high can cause the patient to go into seizures. However, we will give that patient antihypertensive drugs, not magnesium sulfate. Magnesium sulfate is given strictly to prevent seizures from happening. We want to relax that smooth muscle. Okay, let's see how you guys did. That was our last slide. Third place. Ashley D. Great job, Ashley. Second place. Tauntaun. All right, Tauntaun. First place. Drum roll. Zuri. Congratulations, Zuri. Fourth and fifth runner-up. Mandy and Straw B. I'm assuming it says strawberry. Congratulations, guys. Great job. Great job. All right. Let me turn my camera around. You guys did great. Congratulations. When is gonna out and when is it? Okay, when is the NP book coming out? Okay. The NP book is coming out after the PNVN book. So in about 5 weeks, the same book that I released for RN, I'm going to release the version for the PNVN, practical nurse, vocational nurse. And then after that, I'm going to release the one for the nurse practitioner students, okay? You guys got to be patient with me. I'm just one person. You guys are so welcome. Are you going to do more OB questions? I have no problem. I'll make another Kahoot for you. Not tonight. I'm tired. I'm going to bed. But I have no problem doing another Kahoot for you guys. Do you have videos on GCS? GCS. Oh, Glasgow Coma Scale. Absolutely. You will find my videos on GCS in my MedSurge Neuro playlist. Okay? So, I'll say this one time. I'm going to end this live because I want it to be posted on YouTube. So everyone who was participating and you really didn't have time to take notes, go back, watch it. Make sure you take notes. If you have not already ordered your copy, you can do so by going to my website, nexusnursinginstitute.com. And this is a special edition that you will be getting. Okay? nexusnursinginstitute.com. Guys, I'm tired. I gotta go take a shower and go to bed. But have a wonderful night. Listen, if you are studying for your boards and you are having a lot of anxiety, remember. Number one, nursing was placed on your heart for a reason. You got through that whole nursing program. So you think God let you get through that whole nursing program, and I know it wasn't a walk in the park. You think he let you get through all of that just for you to never get your license? Does that make any sense? Absolutely not. Put in the work. Put in the work and trust yourself. Okay? Make sure you get a good night's sleep before your exam. And do not cram. Please, listen. If you don't know it the day before you're going to take your exam, you're not going to know it. Do not cram. You can do a light review, but don't cram. Thank you so much, Professor D. You just gave me my confidence back after failing my first ever test in my second to last semester. Yeah, Stephanie, it happens. It happens. You have your little pity party for 20 minutes. You dust yourself off and you keep it going. Okay? You guys got this. Have a great night. I gotta go. Have a great night, guys. Thank you for watching. I don't even know how to turn off the live on YouTube. How do I turn this thing off? Huh. I see an X to the top left. Let me see what happens when I press this. Oh, are you sure you want to stop